my name is Sarah Mullins, and I'm a mom of a Dravet child and a family physician.
Thank you so much, Dr. Mullins, and welcome. And we appreciate you being here and sharing with us your experience and your challenges.
So I became pregnant with AJ when I was a third-year resident, and so he was my first child, and was normal pregnancy and normal delivery, and had no trouble until 5 months old when he had his first seizure. And we quickly got a diagnosis of Dravet syndrome because we had a pretty adept pediatric neurologist who was one of my attendings, who diagnosed him, sent the test off at 6 months of age after his second seizure, when they said really it's unusual for a child under 6 months old to start having seizures. He had a journey with some pretty intractable, profound status episodes. So, an hour and a half in status the first time we had a seizure. So pretty traumatic like that. Until we found our groove and got into our good routine, where he started the ketogenic diet at 3 years old and was maintained on Depakote and the ketogenic diet for 5 years, status free. When we were 8 years old, we had been 4 months from a generalized seizure, and so that was kind of our typical, was pretty distant, remote generalized seizures. He had a cough in the evening. He had been at school, and we went to go get him and brought him home. And that day he went into a generalized seizure, and it went into status. And so the seizure went on much longer than we had expected. We were one of the families when we were on keto where we didn't have any rides to the hospital. We didn't have to have any rescue medicines, actually, even. But we had weaned keto recently. He had a status breakthrough episode where he seized for nearly an hour, and then after the seizure died, or after his seizure, he did die. Actually, he was in the ambulance when his heart stopped and when advanced life support began. So we actually were under the care of professionals at the time, and they worked on him for half hour before calling it. And so we knew that there was really nothing that could be done. And so kind of almost like the way I liken it, it's like a SIDS death, that once the cascade has begun, there isn't any coming back from it. So that was kind of our story till 8 years old.
8 years old. I see. Yeah, thanks for sharing that. I'm sorry to hear for your loss. Were you aware, and were you made aware by your providers that this was a possibility? It's a tragic complication of having a loved one with Dravet and pretty complex epilepsy.
It's interesting. I actually was well aware. However, it wasn't because of a conversation with my neurologist. It was actually through the Epilepsy Foundation and the Dravet Syndrome Foundation parent group that it was brought to my attention, and I started to learn about it and understand it. It wasn't at all a conversation that I had in the office setting. And it was kind of interesting that was the way I came to learn about it.
Would you have wanted to know from your provider directly? And I think the grain of salt here is that you're a physician yourself, so your access and interpretation of the literature is a little bit different than most caregivers who are not in the medical field. But just looking back, would you have wanted to know directly from your provider?
I would. I think that up to the point where I had learned about it, I had had a child with epilepsy for 3 years without knowing about it. And so if anything had happened in those first 3 years, I would have been unaware. And so I think understanding that there was a possibility was truly something that we lived with, and we knew that reality every day. And the high prevalence with Dravet syndrome, I think even more so. I don't think that we have the level of guilt that some families that were caught off guard or unaware, that if they had only known, they would have done something differently, because we did know, and we lived the way we needed to live.
Right. And just with your experience with other moms and other parents and other caregivers, how do you see their experience as, in terms of, have they been made aware by their providers about the risk of having a complicated, prolonged seizure and the patient passing as a result, or being the victim of SUDEP?
I think it does make other families that are less medically close to the healthcare system. I think it makes them really feel very unsure, that really they're learning about this from other parents, and they're learning about this from advocacy groups and not from their physician. I think it does take a really tough conversation. I don't think it's easy, and I think that's probably why having the conversation is so difficult for providers to do. But I do think that I hear from the families that are in the support group that they would prefer to hear from the physician.
Dr. Mullins, thank you so much again. And if you could, which you are, talking directly with healthcare providers and neurologists that are budding neurologists and trainees in the adult side, what would you like them to know and recommend that they do when they're caring for patients whose risk for SUDEP and death and epilepsy is greater? What would you tell them?
So for families that are connected to the community, we've watched family after family after family bury their child. And so for the families that have survivors to adulthood, they have watched many, many pass before them. And so I think knowing that this is something that they are living every day like it's their last because they've made it this far, it takes an appreciation of the provider's point that they're celebrating a victory. Every birthday is a celebration. There's such a high risk, and these families have made it.